Today's postnatal core workout is designed to help reconnect with your breath, your pelvic floor, and your transverse abdominis muscle, which acts as a corset around your spine. Although it is safe, if you do feel any pain anywhere, any pressure, or experience any incontinence, make sure you stop the exercises and book in with your healthcare provider.
So laying on your back, we're just going to place the hands just below the belly button. Knees are bent, the shoulder blades are melting through the floor, and the back of the head is nice and long. We're just going to breathe into the hands, feel the tummy expand. And then exhale, feel that gentle wrap below the belly button as the hands come together. Breathing in. And then exhale. So the main thing with this breathing, 360-degree breathing, is you want to make sure that it's just not all chest or all belly. So you want to feel that the rib cage is opening at the front, the back, and the sides. And then exhale. Now let's take your concentration to the pelvic floor. So as you breathe in, you'll feel the sit bones widen and the pelvic floor relax. As you breathe out, you will feel that your tailbone lifts towards your vagina as your internal muscles lift up and in. So the pelvis doesn't rock at all. It's that internal lift and that gentle wrapping below the belly button. It shouldn't be a lot of effort. So as we inhale, we just feel that pelvic floor relax and melt. And then exhale, that gentle lift up and in as we wrap below the belly button. From here, we'll add some movement. So as we inhale, we just gently lengthen the tailbone. And then as we exhale, we gently rock the tailbone back. So we don't want to feel like it's a forceful movement. We want to feel like the breath is doing the movement. Inhale, lengthen. And then exhale, pelvic floor lifts up and in as we wrap below the belly button. Inhale, lengthen. And then exhale. So it should feel like that the pelvis is just moving through oil. It shouldn't feel like you're really trying to jam that movement and grip through the upper abdominals. So we'll just go to 2 more. So we'll feel those 2 extreme movements, rocking the tailbone and then gently lengthening the lower back. Good. Last one. And then you're just going to stop in the middle. So from here, we're going to go into a single leg float. So we breathe in and then exhale. Before we go anywhere, we're just going to check in. So make sure that the pelvic floor is lifting up and in. We have a gentle wrap below the belly button before we lift the leg. So keeping that connection, we're going to breathe in. And then exhale, we're going to float the right. And then inhale, lower. And then exhale, float the left. So you want to feel like the movement is just happening at the hip joint. And you shouldn't feel any shift in the pelvis from side to side. And if you're not quite sure, feel free to check in with the abdominals and to feel if that, making sure that there isn't any doming, that you feel some nice tension through that abdominal wall. So it's always nice to remember to exhale when you exert, because that will help turn on the pelvic floor and the lower abdominals. So we're going to go for 1 more on each leg. We're just going to come back to that right leg. So from here, hands on the hips just to make sure that they're nice and square. We're going to exhale, lengthen the leg away. Inhale, float back to center. Inhale, float. Inhale, float. Inhale, float. Inhale, good, well done. Exhale, feel that lift up through the pelvic floor as we wrap below the belly button. Shoulders are melting through the floor, back of the head is nice and long. You have 3 more. Really feel energy out through that heel as you press away. Well done. And then floating back down, changing sides. So sometimes it's nice just to rock out at the end, find that neutral spine again, reset. Take that breath in, relax the pelvic floor, and then exhale, just checking in before we go, lifting up and in, wrapping below, floating the leg to tabletop. Breathe in, and then exhale, find that energy through the heel, press away, inhale, float back to center. Really find length through the back of the head, shoulder blades are melting through the floor. Well done. Halfway. 4 more. Two more, nearly there. 1 more. And then floating back down. From here, we're going to go into your windscreen wipers. So I think everyone thinks of this as a hip mobility exercise and a lower back, and for sure it is, but we also need to think of connecting through that pelvic floor and lower abdominals, so we're not arching or increasing that pressure within that abdominal wall. So just taking a breath in, we're going to exhale as we let the legs drop to one side. Thinking of the lifting up and in through that pelvic floor and the zippering up below the belly button. Inhale back to center and then exhale, float. So sometimes we can get quite tight, particularly through pregnancy, through the obliques. So sometimes it's nice to actually pop the hand on and keep the rib cage melting down, and you'll feel a nice stretch down through those obliques. Inhale back to center and then exhale. So I will show you what it's like when you lose that connection through the pelvic floor. You'll just feel everything kind of hang out and the abdominal wall let go, which you can see some bulging there. And then I'll just show you to this side again. You can see that I've lost that abdominal connection. I'll just go 2 more either side. So we're going to exhale. You also feel when you actually keep the pelvic floor and abdominal connection, you do get a bigger oblique stretch. Inhale back to center and then exhale. 1 more to either side. Inhale back to center and then exhale. Well done. Coming back to center, placing your hands by your side. Just rocking that tailbone, feeling that nice neutral spine. We're going into some bridges. So we're keeping a nice neutral spine here. So we're going to breathe in at the bottom, connect in, check in with that pelvic floor, lower abdominals engaged, and then breathe in to prepare. And then exhale, pressing up through the heels, opening through the front of the hips. Inhale at the top, and then exhale, lowering down. Inhale at the bottom, exhale, press through those heels, and you will feel the thigh bones lengthen. Inhale as we hold at the top, and then exhale, lowering back down. So keeping your glutes nice and strong will just help share the load for the pelvic floor, so it'll take some pressure off the pelvic floor. So just like through pregnancy, we kept the glutes strong to help deal with the load of the baby on the body. We also keep it strong afterwards to just help with the pelvic floor healing and lower abdominal connection. And then lowering back down. We have 4 more. So exhale, inhale, and then exhale, lower. 3 more.
Press through those heels. Inhale. And then exhale. 2 more. Inhale at the top. And then exhale, lower back down. Last one, you go at your own pace. And then lowering back down. Inhale, we're going to float the arms towards the ceiling, going into some dead bugs. So for the first time I teach dead bugs, I tend to do a modified version with the legs down because having both legs in the air is actually quite a high level of demand on the abdominal wall. So for a beginner's level, we'll do a modified version. So again, feel free to just find that neutral spine before we go anywhere, as well as checking in with the pelvic floor and your lower abdominal. So breathing in, relaxing the pelvic floor. Exhale, we're going to lift up and in, as well as right below the belly button, shoulders heavy in the socket. So we know that the pelvic floor and the core is now engaged. Inhale as we prepare, then exhale, we're going to reach the right arm and left leg. And then inhale, float back to center. We'll stay with this right side. Exhale, reach. Inhale, back to center. So we are thinking about keeping the ribs connected to the pelvis. We don't want to see any rib flaring or arching of the lower back. Inhale, back to center. If you feel that you're losing that connection as you float back to center, feel free to stay there for that extra breath. So inhale here. And then really use that exhale breath to float everything back to center. It's okay to take that extra breath if you feel that you need it, because when we exhale, when we exert, we know that it makes it easier for the pelvic floor to engage. Well done. 3 more. One more. And then gently changing sides. So again, finding that neutral spine if you feel that you've come out of it, and then breathing in, relaxing that pelvic floor. Exhale, checking in. Inhale, prepare, and then exhale, left arm, right leg. And then inhale, floating back to center. Breath to movement is always essential when you're exercising, just to make sure that you're not bearing down on the pelvic floor, particularly in those early stages when it's healing. Inhale back to center, and then exhale. Again, remember you can stay there and take that extra breath if you need it. One more. Good, well done. 2 more. And last one. Floating back to center. Making your way now down onto your side into a side plank variation. So we're going to extend the top leg, find energy through the right side of the foot, drop down into the left side body, and then press the floor away. So we want to be active through that left side before we lift up into the side plank. Placing the left palm down onto the floor just to make sure you don't grip through your wrist. And then we're just going to raise that top arm up. So we're just going to breathe in, and then as we exhale, we're going to press and lift, and then inhale, lower back down. Exhale, and then inhale. So we can use that supportive left leg to press down into the floor to get some glute activation as we press up. We are nearly there. Always making sure that you're active through that left side body and you're not drooping down into that shoulder. 2 more. 1 more. And then floating back down. So now going into your clam position, you want to make sure that you're lifted through the left side body. You're not dipping down into that shoulder, so reconnect if you have to. Press away from the floor. Squeeze those heels together as we go into a clam. And then inhale, close. Well done. Long through the back of the head. 4 more. 2 more. And last one. Well done. Making your way to the right side body. So we're going to keep the bottom leg bent. Make sure that right elbow is directly underneath the right shoulder. Energy down through the left inside foot. Breathing in. Making sure we're already active through that right side body, that you're not dipping down into the shoulder. And then exhale, coming up into your side plank in a nice straight line. Inhale, lower. So really feel energy out through the crown of the head and the left heel, and float back down. Three more. Nice controlled movement. 2 more. Last one. Well done. Connect the heels together. Stay nice and lifted through the right side body. Exhale, squeeze the heels. Inhale, close. Well done. We're nearly there, halfway. Long through the back of the neck. 1 more here. Well done. Making your way down onto all fours, and we'll finish in a child's pose. So just taking out the knees slightly wider than the hips. Reach those arms long. If you don't feel you have the range in your back and hips, by all means drop down to the elbows if that's where your body likes to go. For the moment, if you feel comfortable, reach those arms long. Nice way to check in with your pelvic floor here. So taking a nice breath into the belly, feel the sit bones widen and the pelvic floor just relax and melt away. On that exhale, just feel that you melt into those hips. Enjoy the lower back stretch. You've done really well to make it to your mat today. Three more breaths here. Last breath. Well done. And then just slowly making your way back up. Well done.